we'll be able to start the meeting.
I think we should get going since we have so much to cover tonight, and then Amber will slide in.
Sounds good.
Great. So this is Lindy Hinman, Board President of the Boulder County Public Health. I call to order the Boulder County Board of Health regular meeting. It is May 11th, 2026, and it is 5:31. I would like the other board members here to introduce. Steve, you want to start?
June board member.
Morgan McMillan, board member.
Landry Fagan, board member.
Great, and I know Amber will be joining, so we'll welcome her when she gets on the call. All right, we do have a quorum. The notice of this meeting was posted on the Board of Health website, and all calling information and the address was included to allow for public participation. We're now going to move into the agenda, and we will be announcing each agenda item as they come across. The first is a motion and a vote to enter into executive session regarding the Marshall Fire settlement.
Oh, no, sorry.
Wrong topic. I was like, wait.
I missed that typo.
Okay, ignore the last part of that statement. We are moving, I'm motioning. I need a vote to enter into executive session. Here's the motion. I move to enter into executive session under Colorado Revised Statute Section 24640224B to receive legal advice on specific legal questions regarding its obligations, authorities, and discretion to develop and adopt an on-site wastewater treatment system rules for Boulder County under the On-Site Wastewater Treatment Systems Act. Can I get a second motion?
Second.
Thank you. Can I get an approval?
Aye.
Aye.
Aye. Landry, Amber?
Aye.
Aye. I said aye.
Oh, great. All right, all approved. We will enter into executive session on the topic that I stated secondly. Apologies. The executive session will not be recorded.
Right?
You guys are on mute. If that's intentional, that's fine. I just wanted to be sure you knew.
Landry?
I think you're supposed to be in a different room.
Oh,
It's
it's
an executive session right now.
okay. Sorry, I'll double check. Okay.
Yeah, go over there.
Yeah.
Okay.
Hello.
We had a call come in
Are you supposed to be in the other room?
this morning.
There's a lunch in the other day.
Quite sure that the,
There.
I think everybody forgot.
When you're like, oh, the pressure.
There we go, the room's unmuted. Okay, we are back.
All right, we're moving to item number 2. This is for public comment. Are there any members of the public who have signed up to make comment at this meeting?
No, we do not have any members of the public signed up.
Moving to item 3, we get to welcome Joel Wagner, and I'll have Lexi introduce Joel.
Thank you. We are absolutely delighted to announce that Joel Wagner from the city of Boulder is joining us as of next Monday, I believe, as our new administration and finance director. Is the deputy finance director at the city and has been there for quite a while. Has had lots of roles. I think you all read about his experience. He did an enormous amount of work with making sure that businesses were paying taxes and with the FEMA recovery funds and also just broadly, generally, he served as interim for a while, financial officer. So we are really pleased. Joel also comes to us with some fantastic health and racial equity experience. We're really, you've joined, and I'm going to leave it to you to talk a little bit more about yourself.
Oh, my favorite thing. I don't talk about myself, but I'm just really thrilled to be here. As Lexi said, I have been at the city of Boulder for about 12 years. I'm really excited to get a little bit closer to supporting amazing work that people are doing in our communities. I am a Colorado native, went to CU, moved away for a while and realized that Boulder is the place I wanted to be. And so my family and I are here. And so I'm just really thrilled to be supporting a team of people who are making Boulder and Boulder County a more equitable place and healthier place for everybody in our community. So I look forward to working with you all, and I'll be ready to go first thing Monday morning.
Awesome.
Welcome.
Thank you.
Okay, we are now moving to, hold on, item number 4. We are going to be moving into a public hearing that focuses on the amended on-site wastewater treatment system regulations. And so let's see, I will turn to you and the staff. Why not?
You want us to advance the slides for you, Aaron?
Yeah.
Just tell me when to.
Oh, yeah, go ahead. And just to clarify really quickly, for public record, so the way this public hearing will go, the staff will make opening comments and comment on the updated regulations. And then we are going to open the meeting for public comment. The public comment portion of the hearing will be closed and the board will have a chance to ask staff about the presentation. After the staff makes these opening comments, then we will have speakers. If we have any speakers that would like to speak from the public, we will allow that to happen, and there's time protocols around that as well. So we'll move into that as needed. Okay.
Excellent. Well, thank you so much for the opportunity to bring our proposed revisions to the OWTS on-site wastewater treatment system regulations. I forgot to introduce myself, Erin Dodge. I am the Water Quality Programs Coordinator for Boulder County Public Health. So as we get started, I'd just like to center the program. So this is our on-site wastewater treatment system program goal, and that's to protect groundwater, water quality, and public health by ensuring that wastewater is effectively treated through comprehensive oversight of OWTS design review, permitting, installation, inspection, and verification of system performance through ongoing operation and maintenance, use permits, and property transfer certificates. So a little long, but that is the goal that the team uses in like our operating plans and to help us determine what our we have like a 3-year strategic plan. So on the next slide. So until 2013, the OWTS Act was the primary guidance on local public health OWTS regulations. Very vague, very much so just guidance. And in 2013, the first version of Reg 43 was adopted by the state after a very robust process. And it was really focused on moving Colorado toward industry best practice. And there was a real focus change from what we used to call ISDS, which was individual sewage disposal systems, to which we're really focused on the D word, disposal. Get it in the ground. If it doesn't come back, all is good. And then it's really focused on treatment, so on-site wastewater treatment systems. Since counties around the state have varying levels of resources, the state decided, CDPHE decided to make some of the requirements these optional criteria, which you'll hear us talk about tonight. You know, in most cases, these are best practice for public and environmental health, but obviously all local public healths have different resources, different boards of health. Some of them are elected officials, so they might have various challenges to implementing some of these. So this, while the state is encouraging it, and I think would like to see all of these things implemented, they are considered optional. So Reg 43, again, really sets the minimum requirements for LPHA, and we do need to also be cautious as we are adopting things that are specific to the local that we're not in conflict with those requirements. And the state has made a few revisions over the years. The most recent one was in June of 2025, and the regulation requires us to adopt the required changes into our local regulations within 1 year. So that is that June 15th, 2026 deadline. And so we do have, they do not have to be effective on June 15th. We just have to have them adopted by then. Okay, next slide. So as that we have been talking, I just mentioned that there's these opt-in regulatory requirements. So these are the ones that the previous boards over the years have adopted. So we allow the installation of higher level treatment systems. These allow development on difficult lots in Boulder County, which we have a lot of. For example, like high groundwater in areas, you can get a reduced offset. You can get a smaller footprint for the soil treatment area. So you can fit a conforming septic system that's properly treating that wastewater on a smaller lot. And so that was approved in 2014, I believe. It's either 2014 or 18. I apologize, I don't have that date in front of me. Property transfer, that was actually adopted prior to the state's regulation. That was adopted through the Septic Smart campaign that the team did back in the early aughts, 2008. Property transfer was adopted, and that is to, the focus there is to have all systems that, you know, since they're never really, once you install the system, we have no requirements to inspect them ever again. Like we have some from the 50s that have never been inspected since they were installed. And this really requires that when a property is sold, that there is an inspection of the property. It's really promotes transparency of the functionality of the septic to the buyers. It ensures that the system is continuing to function as designed at that time of sale. There's we identify about a 20% rate of failure in those reports, and that's fairly consistent across the nation for all the other states that also have programs that are required like this. There was an adoption of a design flow requirement. So some of these are a little bit technical. I'm trying to be as like layman terms as possible, but when we are determining the number of bedrooms, so most septic systems for residential applications are designed on the number of bedrooms, we opted into not requiring unfinished spaces. So for example, you have an unfinished basement that you could finish later on. We do not require those to be counted in the design flow. So this is less stringent. Some counties do require any area that could potentially be converted into a bedroom to be counted as a bedroom. Another design flow option is that we opted to do 2 people for each bedroom for the first 3 bedrooms. So if you have a 3-bedroom house, there's occupancy for 6 people. For each additional bedroom, we only count 1 person. This is less stringent. Some counties are opted into allowing 2 people for every bedroom from 0 to 100. And we chose that the census, the US Census information for the county says the average household is 2.3 people in Boulder County. So we do think that that makes sense because we cannot regulate. People will say all the time, I have a 6-bedroom house, 4-bedroom septic system, but there's only 2 of us here. We cannot regulate single family primary residences by the number of people living in them. So we felt like this was a less stringent option. So another very technical one is the length of distribution laterals. So those are the pipes in the field. So the effluent goes out into the field to get treated. And we opted to allow longer lengths. This provides more flexibility in system design. We have higher level treatment systems. We see a lot of pressure dosing. So it made sense to allow this. Otherwise, they would have been restricted and you would have had multiple beds and creates a design challenge. So.
Erin, how do ADUs fit in? Are they considered a bedroom or are they considered what is?
So there's some regulatory requirements that the bedroom count has to start over when you're in additional dwelling, because now you've got another kitchen. So you're not just adding a bedroom, you're adding a whole second residence. So the state did make a clarification that you can have an ADU size if there's a primary dwelling for only one bedroom, because otherwise you're required, any new building has to have 2 bedrooms minimum. Even if it's got 1, you still have to size it for 2. So there's all sorts of fun nuances throughout this lengthy document. Another program we've opted into, this was long before 2013, I believe we were doing this, is licensing septic professionals. This really just provides the opportunity for local oversight. We can require continuing education, and it really improves the understanding and quality of the work that's happening in the community and providing service, I think, better service to people who have to hire these folks to do the work. Okay, next slide. And after this one, I'll pause if anybody has a question or comment. So I tried really hard to come up with a way to summarize all of the state's changes, and there was well over 175 changes. And, they were some of them were radical, providing clarification, adding new definitions, and some significant changes to the technical requirements from it must be ASTM standard XYZ from the 2022 version now instead of the 2001 version. So it just didn't make sense. These are all things that are required for us to adopt. These aren't parts of the regulation that are we're able to alter or kind of customize to our own local requirements. And some of the revisions I do want to just touch on are requiring some process changes to our programs. Lots of updating all of our inspection forms, database requirements. The team has identified these and we're working through process changes. And we are creating processes to make sure we're tracking that time. I'm anticipating the learning curve, right? So we should see it go up and come down as our team is learning the new regs. What does it take to implement it? What does this mean? How does this get applied? But there are some that I do anticipate to have a more lasting impact on workload. For example, the state added some language that talks about soil test pits and the intention being to promptly backfill those. So they dig 2 giant 8-foot holes where we go out and look at the soil, and makes sense. They should be probably backfilled. Sometimes they sit open for months on someone's property, which could be a safety issue. But we do not go out at the same time. So it is creating a process change, and we're just trying to figure out how we can accommodate that workload. So that is definitely one we'll be tracking time on for to be able to report back. Any questions on anything so far? Okay, next slide, please. Okay, so the optional pieces, I broke these out into like things that are new, optional regulations and our recommendation. Then we'll go into previously adopted changes to optional requirements, and then ones that are just really specific to local. So we felt like that's what made sense. So hopefully that can help kind of clarify these. So next slide, please. So the first one is monitoring pipes. So these are pipes that are just inserted into the gravel layer or the layer where effluent is applied to the soil treatment area. And currently, this is what they look like. They're all at the end of the field. And the state provided an option to also require them. So this is, we call this the distal end. This is the far end where it ends. And the effluent is coming in on the other side of that big dirt patch. That's the proximal end. So we are our recommendation is that they're going to be required in the four corners. This will provide us better if you're trying to troubleshoot, is the system failing? That's what these are used for, is they're standing water in that gravel layer. That usually indicates failure. So it'll be able to give inspectors a better look into what might actually be happening underground if they're trying to troubleshoot, especially if a new system is failing. We're like, what's happening? Oh, all the effluent is only on this side. Maybe there's a clog or something collapsed after they backfilled. So we think this will provide better, a better ability to inspect and troubleshoot soil treatment
I'm
areas.
sorry, just to clarify, this is for new systems going in,
Correct.
not for, you don't have to retro.
None of these requirements, none of these requirements become retroactive. Even at property transfer, the only time they're required to do something is if it's failing. So we don't ever go back and require that. Okay. Next one, please. So this one is allowing staff. So you would be giving staff approval to approve designs that are up to and not greater than 3 feet from from a property line without coming to a variance. So the current setback is 10 feet, and the current process requires us to, honestly do not know when this was, when they started doing it this way. It was pre-me, which was 2014. But we have a easement agreement that the two property owners that share the property line both have to sign, saying, hey, we're going to go up to, but not over your property line. If they go over it, that's a whole separate process. But so this is going to create a workload change, because we will now have to bring everything that is 3 feet or 0 to 3 feet to a variance. So it will also be, you will be seeing us all a lot more often. So that's fun. But otherwise, we would have to bring everything 10 feet or less to a variance. And this is expensive. Homeowners have to have an engineer do the justification. The engineer has to come to the Board of Health meeting. So that's an expense and a workload for them to get that all organized, workload for our team, and a workload for you all. So we did feel like this was the best option to move forward. And there are some very specific criteria that have to be followed when this happens. And that includes, like, making sure there's surveys and things like that. Okay. Next slide. So this one is a recommendation they gave us an option to opt into or out of this, and we're saying we should opt into it. And it is to allow a reduction in the size of a soil treatment area when the connected structures are only utilizing waterless toilets. That would be a composting toilet or an incinerating toilet. This is the less stringent option. We get an occasional request for this. Homeowners can be frustrated. We're like, you can have that compost toilet, but your system does not get to be reduced because of that. So this is definitely an ask from the community over the years. It's really only for typically seen, most people don't want a composting in their full-time residence. People think they do, and then they learn that you actually have to like deal with the waste. Like it doesn't just vanish like when you flush your toilet. So it does. But I do think it will address issues on small lots and especially in these remote cabins that have very limited use. So I think it's a good option. Okay, so that is you can jump to the next one. Kind of wraps up those opt-in ones or new opt-in options. Any clarifying questions or? No, I gotta look to the folks online too. If you have any, feel free to interrupt me. Okay, so the next set is for recommendations that we are making for things that are optional and have already been adopted by the Board of Health previously. So with all of these, it's in general, we're recommending continuing the program, but making some of these changes. Okay, next one.
No.
Back. Oh,
That one.
back one, yeah. Is that the one I'm on? Yeah. Okay, thank you. So this one is for licensing of our system contractors. And we're recommending that we move this. They're currently required to renew their license with us annually. And we're recommending that it move to being renewed every other year. This will align with our current every other year requirement for continuing education. This will have reduce our workload. And I think it will also reduce the work of our licensed professionals. And we did do some outreach to our licensed professionals to get their feedback on this and didn't hear a whole lot from them, but the ones that we did, they didn't see an issue with it. So it was overall felt like it was supported. Okay, the next one. So this one is in relation to Section 8, which is the property transfer. Really appreciated Kate helping us navigate some language that was making us in conflict with some of the things the state was saying. And so this was really clarifying very specific minimum criteria for what constitutes passing or what constitutes, the minimum inspection criteria and when we have to issue a property transfer certificate. So it clarified to just basically say the exact thing that the state regulation states. So it just reduces conflict between the two regulations. Overall, the requirements aren't changing. We just were able to work with the Attorney General's office to understand that the one of the criteria kind of covers some of the other things that we had specifically called out, like increased number of bedrooms from what the permit was. So if you have a 3-bedroom septic system, but the house is now 6 bedrooms, or permits that have or properties that have never gotten a septic permit. So those can be covered under one of the criteria.
I'm getting confused. Yeah. What does that have anything to do with a property transfer?
So when they have to sell their property, they have to get it inspected. And one of the purpose of the inspection is to ensure that the septic system is operating according to design and not failing. So I thought you were going to say something, so I was going to pause.
Who is inspecting the system?
Good. That's a great question. Yep. So they have to hire a private inspector. Mm-hmm.
So and then part of the requirements of the private inspector to look at the wastewater system if it exists.
Yes. Okay. Yep. And they do verify the number of bedrooms in the house.
Okay. So you're saying if there's a change in the number of bedrooms, then that initiates an additional inspection by Boulder County Public Health?
No, it would initiate that it would need a conditional property transfer because it would not be considered a passing inspection.
Why is it not passing if in the context of adding bedrooms?
So your septic system is designed based on number of bedrooms. And if it was like a 2-bedroom, say the septic was installed for 2 bedrooms. but they built an addition or finished a huge section of the inside of their house. And now it's 6 bedrooms. That septic system is no longer able.
But that doesn't have anything to do with a property transfer per se. It has something to do with a change of use of the property itself. I want a legal opinion on this, Kate, in terms of, I want to be really clean about what we mean by this versus what you're saying, because those are actually two different things in my mind. Some information might become available through an inspection that then makes us think that there is a change of use of that dwelling that was previously not required.
So just one more step of the property. So the inspector does the inspection, but then they submit that to us and we review that, and we have to issue a certificate saying, yes, we've reviewed this inspection report and we are verifying that the system is operating according to design and meets these minimum criteria. And so if it doesn't, so say the tank is failing, or in our case, if the system has never been permitted and approved by us, or the bedrooms exceed that, or they're operating an auto body shop out of their garage, we would then say this does not pass because the system is not designed for the use. So it is a little bit of that, but we are not requiring them to change the use. That is not part of that process, but it is, I do hear what you're saying.
I just want to make sure we're clear under what regulatory authority we're making what decisions. So inherently, if there's a property transfer, that does not mean that there's a change of use. That might reveal information that then moves you to the change of use regulation.
Potentially.
But we need to be very crisp about this legally, because I think we're getting a little confused about what applies to what. So
There's no change of use requirement with property transfer.
but you're describing circumstances in which we engage.
I am describing circumstances that would result in a failed property transfer, not a change in use. Like the new people could buy that house and scrape it and have, start over. So we wouldn't impose a change of use requirement at the time of sale. But we would say this 6-bedroom house does not pass property transfer inspection because it is not, the septic system cannot accommodate that wastewater. So that is considered an unapproved wastewater discharge, right? So they are discharging wastewater into the ground that cannot be treated by the septic system.
Right. What I'm trying to clarify is I don't think that this particular part of the regulation is what you're talking about. So I just want a legal read on this and how we're interpreting what property transfer actually initiates and what an actual change of use or something about the system that needs to be adapted based on public health concerns. So I want to be really clear about these things because I think we're getting a little muddy. I could be wrong, but Kate, I think it's important that we look at that and make sure that we're interpreting that correctly.
I mean, I guess I'm trying to understand what your question is. The property transfer is what triggers our opportunity to check to see whether or not the septic system or the wastewater treatment system is fitting for the property, right? So,
But the regulations that apply to that, I think, are separate regulations, meaning there are regulations that we have that say these are the septic system requirements that you have to have based on this capacity. That's not necessarily related to it. It's like a byproduct of a property transfer. All of a sudden now you have information about the capacity of the system.
right, but how else would we get that information if not through a property?
That's
transfer
fine, but I'm just
inspection?
saying what regulations apply in that context is not the property transfer regulation.
So the one of the other intentions, just to share, is really so that like buyers understand what they're purchasing. So for example, I have somebody who just purchased what they thought was a 5-bedroom house. They paid, I don't know, last time I bought a house, the number of bedrooms mattered. I pay a lot more every bedroom. So they're buying a 5-bedroom house, but unfortunately, they did not adhere to the regulation and bought it without a title or a property transfer inspection. And now they're in the situation where their 5-bedroom house is actually only a 3-bedroom house. And so in order to rectify that, the sale is over. So that opportunity to negate that into the price and say like, oh, that's great, but I'm going to have to spend 50 grand to update the septic. So it's really like helping to provide that transparency to the buyer of what are you purchasing? Because now they're in that situation where they have to do a lawsuit and the whole thing. So,
The state minimum criteria that must be met, and if these criteria are met, we must issue the transfer document. A lot of it is sort of related to the structural integrity of the system itself. Are the tanks watertight? Are internal devices intact and in working order? Are alarms, properly in good working order? There's no specific criteria that the system is the correct size. Rather, what Erin is saying is that public health under the proposed regulations would treat a missized system as an unapproved wastewater discharge. Because there is the state minimum requirement says, or minimum criteria says, there are no unapproved wastewater discharges from the system or structure. So that would be an interpretation that public health is applying. And you can see that language is open to multiple.
Can I ask, so let's say this house went from 3-bedroom to 6-bedroom. When they were getting the building permit, they didn't have to go through the process of sizing the septic system then at that time. Isn't it a change of use at that point?
so we do have, we have a process where we do get referrals from community planning and permitting. And if they're get a permit and they're going through that process, we would then comment like, hey, your system will also need to be upgraded if you go through with this. The challenge is we didn't start doing that until, I want to say it was like in the early 2000s. Sometimes I find things from the 90s occasionally, or if they do it without, like they finish a lot of people I think finish basements without getting permits. So it happens a lot that these pop up and the only way that we would ever know is through
This process. So this is kind of like a catch-all, stuff that you miss through the permitting and
Yeah.
rebuilding process. You catch from him and then you provide
incentive.
assurance to the buyer
Yeah.
that this is.
Yeah.
The buyer and to the public, because
Yeah,
it's
sure.
potentially
Yeah.
impact the
Discharging
public's,
stuff, yeah.
yeah, safety.
Yeah. We know that hydraulically overloaded septic systems. So if you have a system that's small and you have too many bedrooms or too much activity, that more saturated that soil is, it does not properly treat wastewater. It is ineffective. It cannot treat. It's overly saturated. So that is the concern. It is hydraulically overloaded.
And at last month's meeting, we talked about some of the studies that we've done with Public Works that show elevated levels of human sourced E. coli in a lot of our surface waters.
And Erin, correct me if I'm wrong, but I think I remember you saying that there are about 500 dwellings in an incorporated Boulder County that we've never touched.
We went from 4,000 and I think we're probably around 600 of properties that have no documented wastewater treatment system on the property.
And the other thing I remember from this conversation is that if they've done anything in the last 4 years, if they've done an inspection then they don't have to do it again.
That's correct. If the system is less, there is yes, if the system is less than, or I think it's 5 years old. If it was installed within the last 5 years, there's a list of exemptions in the regulation too. And I would also just mention that the number Lexi was talking about a minute ago with the unapproved systems, that number is fluctuating. We have people out there installing septic systems without permits. We had an installer recently that was pulling minor repairs, but installing the entire field. So we have an unfortunate number of people who just think that they got a permit and it did not cover their soil treatment area. So those are other things that we would find out during these inspections. So it sounds like we will made a note of that concern and we will provide some follow-up or clarification. I'm not sure if you have any additional direction on the information you needed.
Yeah, I guess I'm just still trying to understand, Lindy, what you're wondering whether or not whether or not that's the right place to require it.
I'm just saying that I think that this this part of the regulation is not actually regulating change of use. So like, that's all I'm saying. It's a technical clarification, which is this is not necessarily going to initiate if there's added bedrooms.
Mhm.
That's the change of the dwelling itself, and it was uncovered through the inspection process.
Mhm.
But it's not, yeah, so anyway, I don't think, I think we need to move on from that, but I think we're a little muddy here and there in terms of what regulations apply to what circumstances, and I just want to make sure we're really cleaning that up. Yeah. Okay.
James, can I ask a quick question?
Yeah.
This may be something really obvious that I don't know, but are we notified, is the Board of Health notified of every property transfer? Is that a thing?
The Board of Health, no.
Like, or is
We
public health?
could, we could,
I mean, I don't
we
need to.
process
I-
close
I-
to 500 a year.
Are you
So I could send
notified
you
of every,
500.
are you notified of every single property transfer or just certain ones or ones that
So
just?
we process all the applications. So anytime an inspection is done, it's submitted to us and we review that. And ensure that the inspector was looking at the right permit, because sometimes the documents aren't so clean. So if they sell the property and do not do a property transfer inspection, then we do not know about it. We do not have capacity to pull sales data and like differentiate between like in the city of Boulder or on, unincorporated where it's on septic. We did that at one point in time, but we just don't have. It's not something we've been able to do for the several years. So we catch those through referrals or other processes that we review a septic for.
So it's possible that someone wouldn't ask for an inspection and then wouldn't know that they had an undersized septic.
Correct. Houses do sell without getting an inspection. Like the gentleman that I was working was the example. Yep.
I see. Okay, so there's no way for you to have independently discovered that.
I mean, we could, like, sometimes it comes up where I'll start like researching a property because somebody will call and ask a question and I'm like, oh, hey, looks like you bought this property 2 years ago. Do you happen to have a property transfer inspection? Because sometimes we can go back, they'll have it like in their closing documents, it's just slipped in there and the seller didn't submit it. So we will then retroactively, they'll have to pay the fee, but we'll retroactively issue that for them if they have the documents. Okay, should we jump to the next one?
Yes.
Okay. Okay, I'm like, why can't I read? I have to put my glasses on. Okay, so this one is for use permits. And this is a section that we also address the change of use in this section. A lot of it was like formatting and organizational changes, some grammatical corrections. And then in section 1B, we further clarified the language that is requiring a change in use when a change in use is required to be issued or that use permit is required to be renewed, right? So they get the use permit automatically, but this is saying when it's required to be renewed. And this is really to reflect some of the changes that were adopted by the state into table 6.2, which is looking at various design flows across different types of uses of septic systems. It covers like lodging, it covers restaurants, it covers camps, churches, all of that. And they added a section specifically around non-residential other. And that is calling, and under that is a lot of lodging categories, like bed and breakfast or vacation rentals, things like that.
Okay, so just to clarify, the state is requiring a vacation rental to undergo a use permit process.
So the state, the table 6.2 is talking about design flow. So so going back, I was talking about like how we size a residential septic system is based on bedrooms.
Can I just get an answer to that question? Is the state
No.
requiring use permits for vacation
No.
rentals?
They are not.
I think for the board, that's a very important thing that we need to be aware of and has come up as an issue that's been raised, I think, by the community, Lexi, if I'm not mistaken.
Yes, it was adopted, several years ago. An interpretation of the regulations, was adopted by the staff. This has been a source of conversation.
I would say, though, that the state's regulations point to a different capacity that could be generated, and that is what it is addressing. And that they're
It's just inherently a vacation rental does not necessarily mean that capacity is changing.
not necessarily.
Will you tell us, will you just spend a couple minutes, Erin, talking about why why do you see an increased risk and for a vacation rental versus a residence?
Yeah.
Or a short-term rental, or,
Yeah.
And also, as I understand it, the county is interpreting a difference between vacation rentals and short-term rentals.
Correct. And we do too.
And we do too. Okay, so please talk about that.
Yeah. So short-term rentals are typically primary residence for people. And they're like, oh, I travel and I'm out of town and I'm gonna rent it out when I'm gone. We say, you're the primary user of that septic system. It's for the most part accommodating the same cohort and their activities. Vacation rental is a very different, it's been defined as a second dwelling. It is not owner occupied, maybe a couple weeks a year, or whenever they visit that cabin or house or whatever it is. And the use of these are often larger than the number of bedrooms. So we have a pull-out couch. We have triple bunk beds, 2 sets of triple bunk beds in one room. When you have the guest turnover, you've got the guests checking out. If it's a high rented out property, they would have the cleaning company in, or whoever's cleaning, perhaps washing all of the sheets in the house, doing all the dishes. That is not a typical, most people do not do that. And so the data that the industry is showing is high number of failures in vacation rental properties. Heller County provided a presentation to their board recently because they were having a high number of failing septic systems. I'm trying to think of the other county that was. Oh yeah, Summit County has a huge issue with these, right? Because you're renting it out and we can say your septic system is good for 4 bedrooms, but we have they could bring more people to that house. And because it's not a consistent family, it's much more likely that that could happen. And the other concern from a public health perspective is people just staying for the weekend or for a week might not notice this giant cesspool developing. And if it's vacant for a day, that might go away. And then the cleaning company comes in, they might not notice that. And then the next group comes and the kids are like, we found a pond to play in. And there's if you're a property owner, you're going to be much more heightened awareness. And these people live often in other states. And so the oversight of that is a lot less than what a property owner would be doing. And based on the regulation, they're not sized how a primary, I'm just trying to get our new terms down, but a primary dwelling, which is one family or a family unit, whatever that may be, living there sized on the number of bedrooms. And it is changing into a lodging use, which also meets the definition of the change in use in that Section 4 requirement that it has to be evaluated to see if it needs to be upgraded or it's a change that should be documented.
Can you talk about CPMP's requirement for us to review like the occupancy for the vacation rentals and what they're approved for 6?
Yeah, so their community planning and permitting ordinance has a state, like one of the requirements for it is that public health review the septic system. And that requires, because over the years that changing like how systems were sized changes. And there used to be these peaking factors that were included. So you multiplied this design flow by this peaking factor. So a lot of times they're oversized. And so we typically have owners that say like, hey, it looks like my system's oversized. Can we have 7 sleeping spaces instead of the 4 or the 6 for the 3 bedrooms? So there's often a negotiation in there, but the ordinance does implicate public health to review that septic system and determine the number of bedroom or the number of renters that the system can accommodate, because it's no longer being determined on, the occupancy is no longer based on bedrooms. It's now based on occupants.
So I think the question becomes though, we're requiring inspection initially because it's a change of use to a vacation rental, but then we're also requiring ongoing inspections. Is that
Correct. Our recommendation is that they have it inspected every other, so the license is required to renew every 2 years. And we were saying we would do required every 4 years, because that is the general recommendation for best practice for maintaining your septic system, is you should have your tank pumped every 4 years. So it felt like a good opportunity to ensure that that septic system is still functioning. I mean, a lot of these septic systems are put in the 50s, 60s, 70s, and have never been inspected since, or who knows if the tank has ever even been pumped. So we felt like that was a appropriate point. And then, yeah, so every 4 years, and then the renewal is only $100 fee. It's not the same fee.
okay? So there's the first time. So in order to get the permit initially, you do the first inspection, then we would require renewal every 4 years with a smaller fee to us, but they still have to hire somebody, right, to go and do the inspection?
Correct.
Okay.
Yeah.
Just understanding. And then, and again, the idea is that we're trying to catch whether or not there's a system failure or if the system's being overtaxed because there's a risk to the public in terms of. Okay.
Just to clarify, is this happening every 4 years to every single system?
Like the universe of systems or just vacation rentals?
The universe.
Oh, no, just vacation rentals.
That seems strange to me that we would isolate it to just vacation rentals when you just said that there's been systems that haven't been inspected for the 60s. So why are we zoning in on this particular issue, right? Like, that's what I'm trying to understand. I mean, yeah, there's so much fluidity around, the use of these systems.
Right.
And we have no scientific way of actually understanding the use of these
Yeah.
systems. So that could be happening in any kind of context, right? Like, you could just be inviting a big party of people over every weekend.
Yeah.
So I don't, like, to me, this is a little bit of an arbitrary distinction for me. Like, so help me understand, like, why this particular group of dwellings is being called out.
I mean, what I heard you say, and just in response to that, is that if you live on the property, then you're gonna probably you're gonna notice if something isn't working.
I don't,
As
I
opposed to
think
if
that's
you've
like a
got-
specious assumption. I mean, I don't know, like, if there's data to support that, it sounds like there is. There's actual data to say, if you don't own the property, you have a higher propensity to having septic issues.
I think the industry and the data, I think it's emerging data. So I do think it's a limited data set, because I don't think this is something that has been well tracked. But the emerging data that is being shared does suggest that the hydraulic loading is very significant, especially on those turnover days, and it can lead to poorly treated wastewater entering into the groundwater system and early failure of newer septic systems, I guess that would be.
It seems to me like it's an opportunity to catch things happen before it blows up. We have an opportunity, since it has to be licensed, that has to be inspected. Why not take that opportunity to test, make sure that the septic system is going to be viable for the
Right.
whatever use they're going to do.
I think the issue that we're going to be facing, though, is we're going to have a glut of vacation and short-term rentals coming with Sundance.
Mhm.
And this is putting an enormous burden potentially on homeowners that then have to go through this extra special step, whereas normal homeowners that are not renting, et cetera, are,
But she said it's difference between short-term rental and vacation, right?
Yeah, it's only for people who like have a second house that's its only job. Their only job, and it is limited. They're only allowed to have up to, I think it's a 300,
and
between
Six,
250 and 300. I can't remember the exact number. Community planning and permitting ordinance limits that number. And so the other, yeah, I hear your question. Do you feel like that answered? Because
I just, what I'm worrying about is the data that supports this, right? Like
Mhm.
we have anecdotes, we have things that we've heard, and it all makes sense, like it logically makes sense, but how problematic is this in reality, right? And is this putting an undue regulatory burden on a growing population of people? I'm just trying to call that out as a potential counterpoint to the policy, right?
Yeah.
To say, is this really evidence-based? Is it something that we decided because we just instinctually feel like
Yeah.
that's the right thing to do? So,
Can I
yeah.
ask you a question? So if, let's say, we agree to this, when is the next opportunity to revisit this as more data become available? I mean, should we err on the loose side and then tighten up, or do we tighten up and then loosen up, depending on what data says?
I mean, you can direct me to revise these at any point in time.
Yeah.
We can open them for, amendments outside of the state requiring them.
But the more often we change things, the more public education we do.
Right, it's more
Right, because there
confusing.
is that factor too, is letting the public know what to expect.
Yeah. And so I just want to like back up one little step, because for just change in use in general, like this is not the only application of change in use, right? So in 2018, we presented to the current board at the time about use permits and change of use, because this was coming up all the time with not necessarily vacation rentals. Again, I'm talking in general. And these, different activities were coming into play, and we had no process to document these. Sometimes the system was perfectly capable. And so vacation rentals fell into this because it is no longer the activities on the site are no longer meeting the definitions in the regulation of a primary single family unit residential system. And those require, if it's anything other than a singly family unit occupied residential, it has very specific requirements in how that has to be designed. And so that is a fundamental, back to that section 4 statement in the regulation that talks about the hydraulic loading and a change, or what was the word, change in use, or I apologize, I don't have that written in front of me, so I can't think of the words, but any kind of a change in use that you have to upgrade that system, or it needs to be verified that that system is adequate. And so this is an interpretation that the team had made, saying this regulation is now applicable to this situation. It was not applicable to short-term rentals because they're still, for the most part, and we didn't want to put, to your point, we did not want to put that burden on people that are just trying to like make a side hustle. But these are people, we're talking about people who own multiple houses and they're owned by LLCs, and otherwise we're subsidizing.
I don't necessarily.
Yeah, I don't care who owns it either, but I do have I do want to clarify though, it's not about, so I don't think anyone's questioning the change of use. I think it's continuing use, right? So that's, I think, what the question is.
Yeah.
It makes sense that we would inspect it when there's a change of use, including, I think, a vacation rental.
Mhm.
I think the question is the renewal requirement every 4 years, is that something that we think is, protective of public health, or that we are addressing a public health
Yeah.
risk? So I think that's, I think,
Yeah.
the question is.
And
how
I-
change of use.
Well, and the other thing we haven't talked about is the burden on staff and costs to the agency. So are we prepared to do this? I mean, this is additional workload that,
I guess I would be asking the board for that direction, because we're implicated in CPMP's ordinance to do that. So currently, as of yesterday, we are not getting compensated for that any longer. So we are still doing that, but we are not. There, is that what you were getting at? Like,
So, I mean,
the workload is there with or without it.
right, which is, it's not just
Yeah.
about. Yeah, I mean, we have to talk about the burden on staff and we have talked about the associated costs with this. And if it's something that we should be taking, I mean, we really should not be taking on unfunded mandates if we can avoid it, because we do not have the budget to support that.
Yeah.
But
So
we have the option of not doing it.
I guess I would ask direction from the board.
And we were charging for the use permit, so we were getting cost recovery, and the permit fee was set based on the amount of staff time for the direct and indirect costs of doing the review and issuing.
But this is my question, is that the county's requiring a vacation rental get license renewal every 2 years and that public health sign off on it. And we were only charging for every 4 years, or we were charging for every 2 years?
It only just went into effect, and part of our review of this process is trying to determine how often should we really be requiring people to pump their tank and share the permits. Or sorry, the proof of pumping their tank and getting the tank inspected. And so based on best practice of pumping every 4 years, that's what we landed on. The board could advise us to do this every 10 years if a vacation rental is being rented out, every 6 years, every 8 years. This is our recommendation of every 4 years, but you might have a different recommendation.
But just to clarify, there's fees associated with this every 4 years, correct?
It's $1,000 currently based on staff cost of direct and indirect, it's $1,000. And when the permit is renewed at that 4-year mark, it will be $100.
So it's an unfunded. We're not funding this.
We would be getting cost recovery based on those numbers because we cannot charge more than the direct and indirect costs. And that's what we have estimated, that issuing these permits, reviewing the systems, that's the amount of time that it takes.
But we'd still be required by the county to sign off every 2 years.
Yeah, I think that we would just say like it would, so we also have a staff person who is partially is funded by community planning and permitting fees to do a lot of that referral work. That individual, that staff, that position is reviewing all of their like over 2,000 plan review applications a year. And so they would be able to do that in that time. It was just when it was getting into that bigger piece that it's no longer in that realm of that person's work. It moves into like a permitting process.
I mean, I don't know why we would change the timeline from 4 years to 10 years if you're telling us best practice is 4 years, like, based on what information would we change that timeline,
And I think the data gathered, we should be continuing to monitor that and making policy decisions based on data.
Right.
Would be my recommendation. And that we find like, hey, there's a high level of failure, we might want to go to every 2 years.
But if we find no failure,
Yeah.
maybe we would say you only need this at the beginning, the first time that you apply for a vacation rental license.
We're focusing a lot on vacation rentals. There's other, you list other places.
Yeah, it could be
where-
like a farm, they have a lot of different activities. They're having like summer camps, they have open farm days, and they're adding bathrooms to accommodate those guests because they don't want to have portable toilets.
Does that fall under change of use?
So that would be another space, yes, because that's what this is really clarification on is like when, so in the current reg, it focuses on this word like residential or commercial. And that was what was available in the previous state reg. So we were trying to model that, but it became very clear that ag is not commercial, vacation is not commercial. A lot of lodging doesn't consider themselves commercial. So we expand, that's really what the change is to expand that definition to better encompass those uses.
What else falls under continued use other than vacation rentals?
So continued use is really what happens is we assume anything that's issued prior to when this policy went into effect has a use permit. It's assumed. And then anything that's issued that is currently coming through and getting issued, it's a use permit is automatically issued. at pond closure. So it's like issuing a CO for closing a building permit. And so there is no requirement. I would love to, I definitely think, I mean, I have lots of ideas. I don't want to go into those, but kind of to Lindy's point earlier, why aren't we doing this for every system? Like, I would love that. Like, I think that would be really beneficial and provide a lot of data, but is the burden worth the outcome? So there's no requirement for any sort of.
I'm not suggesting that. What I'm suggesting is the criterion by which we would evaluate any septic, right? And I guess what I'm struggling with is sort of what's the triggering event.
Mhm.
And to me, the definition of what type of residence it is feels a little bit arbitrary, that it should be more about, in my mind, the capacity of the system itself to handle
Mhm.
what it needs to handle. And so I just think I think this goes back to the discussion around the regulatory requirement around use permitting and then the triggering event and the other regulatory action, which is more about capacity changes. And so I think, I think it merits us opening this up to say, is this really an appropriate use of this particular area of the regs?
Yeah.
Because I think there's an intent behind it, but I'm not sure that it's fully connecting for me in terms of the rationale, if that makes sense.
Yeah.
And to your point, like maybe we're excluding things that shouldn't be excluded as a result, right? So this is where I think, anyway, Lexi, I'm going to have a procedural check at this point where this is a very complicated topic, and we have other areas that I don't even think we've covered on yet. We are out of time.
Very close to being done.
So what do you suggest in terms of how we manage this meeting at this point?
I would suggest that we let Erin finish her presentation, take off the last agenda item and approve. We can even approve the minutes and talk about the director's report next time.
Okay. Or we can, okay, great.
Ask if there are any public comments for the hearing.
So we'll finish the presentation that turn.
Okay, sorry, I have one last question. Is there anything else that we require a renewal for every 2 years, 4 years, whatever it is?
Higher level treatment systems.
Okay,
And some really specific properties that are undergoing like some data gathering for remodeling or redesigning their septic system. And so they need to understand what their actual water usage is.
okay, thank you.
Yeah.
Public comment can step up or not?
Yeah. No. Okay. I'm going to jump to the next one. Keep us going here. Okay, so these final 2 slides, I only have 2 more, are things that are really specific, like programmatic type regulatory requirements. So, the first one, if you want to jump to the next one, is just around clarifying and some edits to permit and application term limits. So when it's, I'm reading in 2 places, the application, so they apply, but they have not gotten a permit yet. So we're still in this back and forth design review, or, sometimes we just cease hearing from people. And so we're asking to institute a 1-year term limit to that, and that it could be subject to, they could renew that if they needed to, but we would do a renewal fee. And then for permits, so it's gotten to the point where we've actually issued the permit. We've designed, the design has been approved. We've issued the permit and construction has not started. We are not recommending any changes to the term. Those are currently valid for 1 year. That's in compliance with the state reg. They can be renewed up to a total of 36 months. The one thing that we are asking to add in is clarifying that there could be a case where a new regulation might be applicable. So if there was a regulatory change that came along that had a really significant public health significance, we would prefer to see that included and have the opportunity. Or something simple like, hey, the monitor pipes are also now required in all 4 corners versus just at that one end. So it would just be when they renew it, we would just make those updates, or potentially ask them if they need to get a design review. The other two are permits. One is when construction has started, but it has not received final approval. So sometimes it's still pending an additional final inspection or and so in those cases, we're saying, we would like to see those expire after 3 years. We do a lot of sending emails, notifying people, hey, this is still open. But if we are not having any action after 3 years, we would like to close those. And then in some cases, that construction is complete. However, we're still waiting for documentation from the engineer or installer, like a final approval letter or final as-built drawing. And so we would like to see those expire 1 year after our last inspection. And this is really like to improve our record keeping. We have permits that were issued back in the early 2000s, and we've been emailing and trying to get people to follow up and figure out what's going on. And we're asking for permission to create those timelines so that we can have accurate records. So we would close them without approval, and then we have created a process for what would be required for those people, like if they did have a system installed, like what would they need to do to get that approved? Okay, and then the final one is, these are just some definitions that were.
Next slide.
Oh, sorry, thank you. I'm watching my screen. So these are some definitions we're asking to have added in. The first ones are around storm drainage systems, and those are to pull language from other regulatory language or permit language and requirements. And these are really just to help identify what setback is required when, because there's required setbacks from these features to a septic system. The next one is residential other, and this is a category that was added by the state to their regulation. It is in our table 6.2 as required by the state, and this will just define it and provide clarify the applicability of what does that category mean. The other one is unapproved wastewater discharge, and this is really to provide clarity and applicability in the property transfer section of the regulation. And this was after some discussion with the state health department and them getting guidance from the Attorney General's office. And then the final ones are some specific terminology from our partners over at Community Planning and Permitting. This is in their land use code. And we are incorporating these by reference. And we're defining what that applicability means, because their use definitions and use is just different than how we look at that from septic. And the state's regulations that we're required to do and theirs do not, people get confused very easily. So we're trying to create some clarity for the community. Did I miss anything on those? No? Okay. All right, that's it. Those are the changes. There's lots of also just sort of grammatical formatting. We moved some sections around, but overall, those were the substantive changes. I guess
Move to the hearing.
Yes, just Steve, before he left, just had a suggestion that I think is a really good one, which is I think we need a visualization, some sort of flow chart or something that shows what triggers a permit, under what circumstances, and whether that is from the state regs or interpretation by BCPH. And if we can get that, I think this is incredibly complicated, and it's tied to existing regulatory decisions that were made before this current board was sitting. So I think we need to see that to fully understand it. I think it's almost literally impossible to really understand what's really going on here. So if you were educating somebody out in the community, how would you talk about this, right? I think we need that level of understanding to be able to prove any of this, because it's incredibly complicated.
And just to help us sort through, if we want to go back and revisit things, right? right? How do we fit it all into something that is cohesive, coherent,
Yeah.
consistent?
And I think what we'll clearly care about is the impact to the community, right? So the things where the community is then involved, I think that's where we want to see what those events are, what the decisions were, and whether that was our decision or comes straight out of the regs that we don't control.
I think that's a great idea.
That was Steve's idea, so we'll not claim it. Okay, thank you for this.
It's a lot, I know. It's very.
Yeah, it's hard to follow. It really is, but thank you. I appreciate how complicated this is. And I also appreciate that the team is really trying to protect the public's health through all this work. And that there's some ambiguity in certain things and we have to push through that. Okay, so Lexi, I think we'd like to open a public hearing.
Yes.
Patrick?
We don't have anyone signed up for
Okay.
public comments.
All right, then I think we can close the public hearing section of the meeting. We just, for the record, the Board of Health will be voting on these policy/regulatory changes in the next board meeting in June. And we wanted to give ourselves a minute to digest this incredibly complex topic, so.
And I think we would also invite the public, if they have other thoughts, having seen the presentation recording, like, you know, if you want to send us public comment between now and then, that's great. We invite that. We would love to hear from you.
Okay, Lexi, we've lost 2 board members.
Still have a forum.
We still have a quorum. Should we try to, what do you want to do at this point? Do you want to?
I think we can wrap it and pick up the rest of it next time. Is there any problem with that?
I don't see anything in the bylaws that require us to vote on the meeting minutes or anything, so I think we can push that. Yeah.
Amber, Morgan, can you guys hang on for 10 more minutes and get the approval of the minutes?
Yeah.
I think we can probably get that done fairly quickly. And then, yeah, okay. All right, so with that, I make a motion to approve the meeting minutes from April 13th, 2026. Can I get another board member?
I second.
Thank you. All in favor?
Right.
Aye. Amber, did you vote? I didn't hear it. Oh, okay, she's giving a thumbs up. All right. All right, the motion is approved. The prior month's meeting minutes are approved. Do we want to talk through director's report or should we? I'm happy.
I'll answer any questions.
Okay. Morgan or Amber, did you have any questions?
Did not. Amber's shaking her head. She did not.
Okay. I'm sorry, I just highlighted. Yeah.
Yep, that our 2026 budget book received the Distinguished Budget Presentation Award from the Government Finance Officers Association. Our staff picnic is Thursday. We have revamped, we have tried to reorganize the director's report. You know, this is an ongoing challenge for us to figure out exactly how to get you the information. We've started reporting HANS, which is the Health Action Network alerts. As just a general information, we are continuing to have kind of, you know, the top public health headlines. And we've structured a lot of the report around in the same way that our agency performance system is structured, so that when that information starts to flow in, it'll be easy to align.
I think the only thing I wanted to call out is because we did not get to this agenda item, but it's actually quite important, is the warm, dry winter impact on public health. And I just want to draw everyone's attention to that part of the director's report. And then Lexi, it would be great if we could talk about that in the next meeting. If there's anything important that you think the board needs to be deciding on relative to that topic beforehand, please let us know. But my interpretation was that it was more of a cautionary tale about what we could see as a result of the warm, dry winter that we've had.
And also what we're doing to prepare, and where we see some very serious gaps in community coordination and response.
right, we'll look forward to that as a topic for next meeting, given time. Okay. All right, any old or new business, any additional announcements? All right, there being no further business, this meeting is adjourned at 7:25. Thank you for everyone's time. Really appreciate it.
Thanks.